The NIH has awarded a 4-year, $1.45 million grant to LSU Health Shreveport researcher Dr. Wayne Orr.
The grant is for studying the role of a specific family of proteins called NIC adapter proteins in the process of atherosclerosis, which is the buildup of cholesterol, lipids, and inflammatory cells within the large arteries. Normally, the lining of blood vessels keeps the vessel healthy, it's quiescent, it's not leaky. But when a plaque starts to form, the lining becomes activated and it stimulates white blood cells in the circulation to bind and migrate into the vessel wall. This happens a lot in response to a cholesterol buildup, some of your bad LDL cholesterol building up in the vessel wall. The NIC family of proteins appear to be involved in that process, and we are looking to identify how they're involved in it, what their signaling partners are that mediate their effects, and whether we can reduce the formation of atherosclerotic plaques by affecting the signaling through those NIC proteins.
Today, treatment for cardiovascular disease focuses on controlling risk factors like high blood pressure and cholesterol, but this research could pave the way for new types of drugs.
It's a long time between finding something at the bench and actually having it translated out into the clinic. However, the ultimate goal is to identify new mechanisms to inhibit this NIC family of proteins or some of their signaling partners and use that to reduce inflammation associated with cardiovascular disease. As of right now, none of the treatments actually target what's going on in the vessel wall itself. None of the treatments really target the inflammation that's going on or the remodeling that's going on in what we call the vessel microenvironment. So, all of the changes that are going on in the vessel wall itself. So this would potentially be one of possibly several therapeutic targets that get at targeting the remodeling that's going on in the vessel itself.